Afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, today I'm going to tell you about the transport of oxygen in the blood. So, diffusion of oxygen from alveoli into the blood capillaries. And during inhalation, air is taken into lungs through nasal cavity, which passes through tracheae, bronchi, bronchioles, and then alveoli. So, the air which reaches the alveoli is alveolar air, which is rich in oxygen, and blood reaching the capillaries surrounding alveoli is poor in oxygen and rich in carbon dioxide. So the gaseous exchange takes place at the surface of alveoli by the process of diffusion, and at the same time, RBC in capillaries release the carbon dioxide which diffuses into the alveoli. So the transport of oxygen in blood, how it is transported. So the hemoglobin plus the four molecules of oxygen binds to it. Then hemooxyglobin is formed, and then 95% of oxygen is carried in this way. So in this way, as shown in this figure, RBC and then hemoglobin molecules are present. Then oxygen from lungs binds to it, and then oxygen bonded with the molecules, and then again these blood is carrying this oxygen, and then wherever it is needed in the tissue, then these oxygen molecules are released into the tissue cells. So it is transported by blood either in combination with hemoglobin in the RBC, that is more than 98%, or in the blood plasma, that is less than 2%. It is shown here. Then this is the structure of hemoglobin molecule. So linkage of heme with globin. So this pink circle is representing the globin chain, and blue rectangle is representing the or we can say protoporphyrin ring. And this is the hemoglobin molecule, in which we can see this is the cell and in this RBC cell there is presence of hemoglobin molecule. This is the structure of hemoglobin molecule, having the chains of alpha and beta chain, iron, heme group is present. Then these are responsible for transport of oxygen and carbon dioxide in the human body. So HB molecule consists of four polypeptides, two alpha chains of amino acid and two beta chains, and these are attached to the heme group. There is one atom of iron at the center of each heme, and one molecule of oxygen bind to each heme. So, and this reaction is reversible also. So the reaction is here is shown. A role of hemoglobin in oxygen transport. So 97% of oxygen is carried in chemical combination with hemoglobin in RBC, and 3% is dissolved state in plasma. So oxygen is carried to tissue by almost entirely by the hemoglobin. Then oxygen binding capacity of blood. So the maximum amount of oxygen that can be bound to hemoglobin in blood depends on the hemoglobin concentration. Like it is measured at 100% saturation. Usually 1 gram of hemoglobin can bind 1.34 ml of oxygen. Normal blood is 15 gram per deciliter, and so oxygen binding capacity is 20.1 ml. So during strenuous exercise, the 15 ml oxygen delivered to tissue and 5 ml remain in blood and return to venous supply. And during normal physiological condition, the 5 ml of oxygen delivered to tissue, 50 ml of blood return, or we can say venous supply. So every 100 ml of arterial blood transport, 20 ml of oxygen. Then uptake of oxygen by the pulmonary blood during exercise. So the body require as much as 20 times the normal amount of oxygen because of increased cardiac output, or the blood remains in pulmonary capillary may reduce to less than one half normal. So this is the oxygen dissociation curve. There's a left or right shift according to the conditions. Then oxygen transport system, like a benefit of training is that increase in heart size, more blood is pumped. It also lowers the heart rate, so more fitter you are. Anaerobic threshold is increased. Exercise aerobically for longer and higher intensity. And during exercise, the lung size increases, so more oxygen uptake is there. There is also greater capacity to exercise. And VO2 max is, we can say, the maximum oxygen uptake in 1 minute of exercise. So usually at rest is 12 to 15 per minute breath we can say. But during exercise 30 to 40 we can say breaths per minute. Thank you.